North Dakotans are sharing their personal experience of loss due to COVID-19 with the help of a new website. The North Dakota Department of Health's COVID-19 Impact Wall was launched Wednesday. The statewide campaign will feature videos and short stories from North Dakotans affected by the coronavirus. It's also intended to serve as a memorial for those who've died with the virus. The $775,000 federally funded public health campaign will run for 2 years. The state health department confirms 1,843 active cases as of Wednesday, up about 50% from just a week ago.
Well, the Pentagon is now requiring all military personnel to get vaccinated. And according to a memo sent Wednesday by Defense Secretary Lloyd Austin, service members must, quote, impose ambitious timelines for implementation of the COVID-19 vaccine. Now, the memo, however, does not indicate a specific timeline, but it says military services will have to report regularly on their progress. The Pentagon says that troops will be able to get Pfizer shots at their bases or from their commands around the world. Individual service members can also go out and get any of the other COVID vaccines on their own. And according to the Pentagon data, more than 800,000 service members have yet to get their shots. And now that the Pfizer vaccine has received full approval from the FDA, the Department of Defense is adding it to the list of required shots that soldiers must get as part of their military service.
North Dakota is seeing a spike in cases, specifically the Delta variant. Nikaya Carrero tells us how the state lab is handling an influx of tests.
For the first time in a long time, the North Dakota Department of Health reported 6,000 tests in one day, may it be a PCR or a rapid antigen test.
And so I was interested in knowing, well, where are we now compared to where we were about last year? And when I looked at that on Monday, the number of cases were about the same, but our testing was only a fraction. Our testing today, or this year, is only a fraction of about what it was last year. So we're seeing many more positives coming out of fewer tests this year.
Since the beginning of August, more people have become symptomatic, and there has been more than a 300% increase in cases across the state.
I think what we're seeing here is really a manifestation of the Delta variant being that much more infectious.
After receiving a positive test, the state lab evaluates it to see if it's eligible to go through additional testing in order to determine which strain of COVID it is.
For those that are successfully sequenced, it will go through the process of being assigned a lineage. And for that, because some of that fails too. And for everyone that's successfully assigned a lineage, it will get reported back out.
Kruger says testing samples for variants allows the department to have a better understanding into what's going on. This week's samples show that all the tests taken were that of the Delta variant. Reporting for KX News in Bismarck, I'm Nikaya Carrero.
And testing for variants can only be done with PCR tests and not rapid antigen tests because there simply aren't enough particulates collected. The last set of tests reported in the state show 153 new variants of concerns.